In this video, our group will be talking about metabolic syndrome, which is a cluster of biochemical and physiological abnormalities associated with the development of heart disease, stroke, and/or type 2 diabetes. Please pause the video to read our case before moving on. Exercise is beneficial for somebody with metabolic syndrome, especially when resistance and aerobic training are combined. It helps to control glucose and TG levels, which significantly reduces body fat and therefore influencing LDL-C levels and HDL-C levels.
The provider we are using for this exercise routine will be an outpatient physical therapist. The therapist will work one-on-one with our patient to do aerobic and strength exercise training, and will give them an HEP for the patient to do at home in between sessions. The setting will be an outpatient physical therapy clinic that the therapist works at, and the patient can either do their home exercise program at home or at a local recreation center or fitness center nearby.
The materials needed for this patient would be a treadmill or a walking track, resistance bands, dumbbells, a pulse ox, and a stethoscope. Additionally, we would need the 6-minute walk test and the Borg rating scale for perceived exertion. The pulse ox would be measuring heart rate and oxygen saturation pre- and post-assessment, in addition to the stethoscope measuring blood pressure. The 6-minute walk test would be used to record the patient's exercise prescription, and then the Borg rating scale would be performed to assess the patient's perception on their own effort, breathlessness, and fatigue during physical work. Initial exercise should be of moderate intensity, paying attention to each risk factor present in the patient. For both aerobic and resistance training, recommendations should follow the disease or the condition the patient has with the most conservative guidelines.
Frequency and number of sessions per week for somebody with metabolic syndrome is going to be 5 to 7 days. Aerobic exercise is going to be 2 to 3 times a week. Resistance and strength training is going to be 2 to 3 times a week, and combined aerobic and resistance strength training is going to be 3 to 5 times a week. Duration of the program, this is a lifelong condition, so the schedule becomes a lifestyle change that can be altered as necessary. Patients should seek progression or regression of the program based on presentation of symptoms. An example of a 6-day workout schedule would be like this chart on the right of their whole schedule details, and of course this schedule can be altered in different ways.
With our patient, we're going to start off with 30 minutes of aerobic activity at moderate intensity, keeping the HRR between 40 and 59%, and he can do this about 3 times a week to start. If he can't do the 3 times a week, he can do a total of 150 minutes of moderate aerobic intensity activity for the first week, and then he's going to gradually increase to about 250 to 300 minutes a week of moderate intensity aerobic activity, or he can do 50 to 60 minute 5 out of 6 days a week of the moderate intensity aerobic activity. Along with the aerobic activity, the patient should also incorporate at least twice a week of muscle strengthening resistance exercises. That should be for both the upper extremity and the lower extremity. Patient, some contraindications are going to include heart disease, stroke, and type 2 diabetes that we're going to want to make sure we stay aware of and monitor. Also, throughout his treatment, we're going to have communication with nutritionists to help with his dietary plan and changing his diet. Also, his primary healthcare provider, just in case there's any type of referral needed before he starts to gradually increase his physical activity. And then also, just to make sure that we're staying safe, we might have some communication with his occupation as well.
These are our references, and thanks for watching.